And tonight on our Great American panel, she is an assistant professor of political science at Occidental College in Los Angeles. Carolyn Heldman is back. He is a former Indiana congressman, current president and CEO of the Club for Growth. Chris Chicola is with us, and he is a best-selling thrill writer and author of the brand new book, Vanished. Yes, I got to read this. Joe Findar is back. And guys, good to see you. Thank you for being with us. All right, Barney Frank talking down to his constituents. We've been watching this at all these town halls around the country. Argumentative, arrogant, and people are asking great questions. Earlier tonight, let's roll this tape.
We were promised we'd have change that we can believe in. So far, if we are going and having all these changes, and I haven't got a clue as to what they are, how can I believe in it? How can we trust the government that's shoving things through without letting us have a reasonable discussion about it?
You asked me, how can you trust the government? Let me answer the way I answered before. Whoever told you to trust the government? You live in a democracy. Don't trust the government. Use your own individual initiatives. Excuse me, sir, may I respond?
That's why we're here. Just argument. Now, here's the question. Government bankrupted Medicare, Medicaid, Social Security, and unemployment was supposed to go above 8% with the stimulus passed. That guy's right. Why should we trust them on health care?
Well, I think that Barney Frank's response was really wonderful, right? He's saying don't trust government. It's a democracy. Get educated about it and go and have your say in the policy.
But Barney Frank was part of the Democratic coalition that wanted to ram this bill down our throat without reading it in 2 weeks.
Well, healthcare is a really complicated issue, and so far we're in the land of fiction, not the land of fact. We're in the land of fiction with healthcare, where there are death panels and euthanasia and abortion.
I've read the entire bill.
Have
you read the entire bill?
I have read the entire bill.
Page 425 and 430. And Chris, I'll throw this to you. It was very, very clear that end-of-life counseling. I don't want a bureaucrat that is designated to save money talking to an elderly person and offering them end-of-life advice. Do you?
No, I don't. And, Sean, I think this is the first time I've ever agreed with Barney Frank. He shouldn't trust the government.
Yeah.
But there's a reason that people don't trust the government. They can't think of a thing the government has ever run well. They think of the post office. They think of anything.
Even Obama said that.
Yeah. Well, they want health care.
The post office doesn't run well, sir?
They're broke, too.
What I'm saying
they're broke
is
because of the advent of the Internet. The post office is a very efficient, wonderful organization.
Well, we could argue about that, but I would say what Obama's offering is a healthcare system with all the efficiency of the post office and all the compassion of the IRS. And people understand that, and they are scared. And because there is fear, there is now anger.
And I think you're right. And a lot of the anger now is due to the fact that they made a lot of promises about the stimulus, about the economy, none of which are coming true. 60% of Americans think the stimulus has failed to this point.
You know, the thing about Barney Frank, I like him, I admire him, I disagree with him. He's wrong. And I live in Massachusetts, okay? Mitt Romney was our governor, and he pushed universal health coverage through. And
this is a different idea, and it's a little complicated.
No, but listen, it was terrible.
It didn't work.
People have to know this, that he said it will not cost you any more, okay? Right now in Massachusetts, the program is going broke. All right, people just are not really aware of this. It's a disaster. My sister-in-law has to wait 4 months for an appointment with a cardiologist. I mean, it's really, and it's costing us more wait time for less coverage. So if that's a model of what Barney Frank is pushing for, I'm worried about that.
Now, the Democrats are involved in all this infighting. You got the liberal wing, you got Anthony Weiner and others saying, hey, you know what, 100 of us are going to leave if we don't have the government option. That's what he's saying on the one side. On the other side, politically it's not viable because the American people, every credible poll shows they don't want what is being pushed. The question is, if they change the verbiage a little bit and they focus group it and they say, well, now this is going to be a co-op. If the government supplies the services, the pricing, and the supply, isn't that still government health care?
You're talking about the cooperatives where people get together and they try to have more bargaining power in the market? That doesn't sound like a government program.
No, but if the government controls the pricing, the rationing, what health care you get.
That's a myth, Sean. There isn't rationing in health care policy. In fact, it'll bring down costs and we'll have greater choices.
Wait a minute. Medicare is rationed. Listen, right now people are denied coverage with the government system.
Well, Sean, Harry Reid said that you can call it whatever you want. It's going to be a public option. It's going to be government-run. health care. But, Rahm Emanuel is always very insightful, and he said the goal is not negotiable, but the path is. So I think this is a new path. Let's call it something different. Harry Reid said we can call it whatever we want. I think we should call it a Trojan horse. It's set up by the government. It's financed by the government. All the products that will be offered are dictated by the government. It's government-run health care.
What if the Democrats go it alone, as New York Times is going to come out tomorrow, it's on the Drudge Report tonight. What will happen?
If they do that?
Yeah.
It's not going to work. It's going to be I don't think it's going to go for the Senate, in fact. I don't think it can work.
So you think Ken Conrad's right, this is DOA? Because I think that Obama will literally, this is the holy grail for liberals. They want this in the worst way.
Well,
that's right, Sean. We think of health care as a basic human right, and it's unconscionable.
Where in the Constitution does it say that? Where in the Constitution does it say that? Where
in the Constitution does it say we have a right to privacy?
Well,
it has been interpreted in the Constitution, Sean.
Interpreted
it's a basic
by liberal activist judges, Caroline.
Are you saying that we shouldn't be watching out for? Are you saying we shouldn't be providing care to poor people?
I'm saying that the government that screwed up Medicare and bankrupted Social Security does not deserve our confidence, and you have confidence in the government.
I have confidence in government as much as I do in a private sector, and with healthcare raising the healthcare insurance companies raising our premiums by 80% since 2002.
You're making me mad. I'm going to throw the football at you.
All right, let's go.
All right, more with our great American panel next. Good catch. All right, we continue now with our great American panel. All right, we're having a discussion here during the break, and so we're going over these numbers. Everyone says, well, 47 million Americans are uninsured. If you factor out the people that are temporarily uninsured or don't have health insurance, on average 3 or 4 months, if you take out illegal immigrants, you take out young people 18 to 25 that choose not to get insurance because they want to save money, we're dealing with about 15 million people. Now, why would we change a system that is the best in the world, that has advanced care, prolonged life, and given us a better quality of life for 5% of the population?
Well, I would say 2 reasons, Sean, that we need reform. One is that we pay twice the amount as other advanced industrialized nations for the same care.
That is not true.
That has been found in every major study, easily accessible, even via the internet. But the second reason is, again, I was bringing it before the break, since 2002, our premiums have gone up 80%, and healthcare profits for insurance companies have gone up 400%. That sounds like a monopoly to me. We need some market competition, and the government is exactly the entity to provide that.
But the CBO, and I'll throw this to the Club for Growth, even they said tens of millions of people will be forced out of the private system into the government system. Here's my solutions. Tort reform, medical savings accounts, tax credits for people who can't afford it, so that they can get catastrophic insurance, which is the thing that most people are concerned about. None of these things are being discussed in any of the versions.
Get rid of mandates, let people shop over state lines. There's a whole bunch of
This is a really important point.
But this isn't about coverage, Sean. This is about control. It's not about covering the uninsured. It's about government control of health care, and that's the dirty little secret.
Isn't that? Let's focus in on that. Isn't this about government power? Isn't he right?
I don't think so.
No,
I don't think so.
I do.
I don't think it's about, because I don't think the objective is for the government to take over. I think that it's a means that's a problem. We don't want this. Government should stay out as much as possible of health care, because look at Medicare. You hear that it's a 3% overhead, right? Medicare. You know why? All they do is write checks.
Let me tell you why you're wrong. Let me tell you, in all seriousness here.
I think we agree on this.
No, we don't agree on this, because
I believe in private enterprise competing.
If the government controls this, it will change the relationship between the citizen and the government, where every American now has to, please, government, please give me this. And that fundamentally, everywhere it has been tried, it has failed. And I do not understand why anybody would put their faith in the government.
Look, I have spent time in the Soviet Union, okay? And I've been through their healthcare system, and it's terrifying.
How about Canada? How about Great Britain? How about France?
No, Britain, but
Britain? Women with breast cancer can't get their medicine.
I wasn't defending Britain. I was talking about Moscow. But no, I really think that the issue, and this is where Chris and I totally agree, is that you got to have health insurance companies able to compete to lower the prices.
But they are competing. There is free market right here.
Not really.
Yeah,
not really. There's too much government control of state mandates in the states.
That is
you have to agree on that concept.
No, that's true. You wanted to add, Carol?
Well, I think that we need to deal with the rising healthcare costs, right? And if we don't have a really competitive market for healthcare, which I think we don't have, primarily because consumers have no idea how much they're paying for health care. They don't know what procedures cost. Just a basic fact about purchasing something.
And how about the tax credits? How about the portability issues?
I think those are great ideas.
And medical savings accounts.
And tort reform, 1% of costs, that's not a big solution. Health savings accounts, promoting that as well as a public option, especially for catastrophic, is a good idea.
I think that 1% is a misleading number because it's
an American.
If you look at strictly torts related to medical malpractice, but when you think of all the defensive medicine that we practice in this country to try to avoid things, when you think of not being able to go to the root cause analysis of a medical mistake because you're afraid to create a record for a trial lawyer, that costs trillions of dollars. And
tort reform in Texas worked.
Yeah, no, there's no question.
You know, what people don't think enough about is the fact that private insurance companies, who they often hate, actually work harder at cutting costs. Medicare doesn't do any of that. Private insurance companies, they're incentivized to do it.
Medicare pays doctors 10 cents on the dollar. I mean, these guys can't even keep their offices open.
Well, yeah, they don't negotiate,
so
right?
You have a monopoly mandating it.
I agree. The end result, if it's government takeover, is a terrible thing.
All right, great. Folks, this debate will not end. Good to see you all. Thank you for being with us. And that does it.